All right, thank you for coming today. So my first question would be, like the obvious question would be, what is forensic psychiatry and how did you become one?
So forensic psychiatry is the subspecialty of psychiatry. It's where the interface between the law and psychiatry. It deals with clinical care, for example, treating people in correctional settings, state hospitals, sex offenders. It also involves what I'd consider expert witness or independent medical exams where, let's say, someone has a criminal case or a civil case and they need a psychiatric evaluation and possibly to testify in that case as well. I was always interested in psychiatry, from particularly the beginning of medical school and also towards the end. I was always interested in psychiatry. And then towards the end of my psychiatry residency, there's a lecture by someone who does some expert witness work, and I was really fascinated about it. I just loved how it felt like you're a detective trying to come to the truth. And I also was looking for variety. I enjoy clinical care, but I wanted to, vary things up. So, some days I'm treating patients, some days I'm working on a case, and it's very interesting.
Crime stories are I always watch crime stories all the time because they're just so interesting. It's interesting because you never know what's going to happen when someone's brain just clicks, what I mean?
True.
Okay, I did manage to look on your website, and you currently are working at TIRR Memorial Hermann. It's the best rehabilitation center in America.
It's great. I see a lot of patients with brain injuries, or those who had strokes, spinal cord injury, other neurological disorders, and a lot of them have neuropsychiatric sequelae from their injuries. It could be depression, PTSD from the injury that caused whatever accident they had, or the spinal cord injury or the brain injury. Also, they could have a neurocognitive disorder, otherwise dementia from the brain injury. For example, if someone with severe brain injury, they're not able to participate in the rehab because of depression or any other psychiatric issue. Sometimes treatment would help them better able to cooperate or go forward with their rehabilitation process.
I also looked that you did work with prison inmates as well, and I do have a question for that. How was it treating death row offenders in prison there?
It was interesting. A lot of those folks, they require psychiatric treatment. I was working both in a psychiatric unit, essentially a psychiatric prison hospital, and also outpatient to another unit that housed ADSEG, or restrictively housed in offenders and also death row offenders. And unfortunately, they've suffered a lot of abuse, difficult upbringing, substance use. A lot of them have psychiatric problems, so they require psychiatric treatment. I've treated both victims and I've also treated perpetrators of violence, and they could even get PTSD from their violent act, from witnessing what their victim went through.
According to the U.S. Department of Justice, Houston is the biggest sex hub for trafficking. Well, Houston is the biggest hub for sex trafficking. I do see in your biography that you do have experience in analyzing sex trafficking victims. In your experience with former sex trafficking victims, what is one thing you learned from those cases that has helped you understand brain activity?
So I do work for the Physician for Human Rights and other associations where there are people in the immigration system where they are also trafficked, and they qualify for immigration status based on being victims of their trafficking, because they need help with their psychiatric assistance and they may not get that at their home country. So I would evaluate them and produce a report for the court. And a lot of them have some of the worst cases of PTSD I've seen due to their, it's not just one isolated assault like some people with PTSD may have, but they've had continuous repeated trauma, and that can complicate their PTSD.
My last question will be towards mental health. Mental health is something that everybody is more aware about. They're saying, depression, things are going on with themselves. They have trauma from childhood experiences with their family. Everyone is being very vocal today about actually having mental health problems. With having it such, a public thing, and public, figures are coming out and saying, hey, I have mental health issues. How would you advise a family or a friend to help that person and get them some help? Or if they were resisting help, how would you have them go about of getting that person some help?
Yeah, a lot of times family members don't understand that people with, for example, severe mental illness, schizophrenia or bipolar, they have what's called poor insight, and it's a lot of times the lay public might think, oh, they're just, they're just in denial. It's not. It's more than that, And usually, what happens is when they have the most symptomatic, for example, they get very delusional, start hearing voices, and they have an exacerbation or increase in symptoms, then they'll start thinking there's nothing wrong with them. Then they'll stop taking their medications, and then they might start using alcohol and drugs, and then which worsens. Basically you're taking out the one thing that helps in medicine, and you add something like methamphetamine, which almost essentially does what's opposite to what the medications are trying to do, and then their symptoms get worse. And then I've seen a lot of cases like that when I was working at inpatient psychiatric hospital, and it's very difficult to get these folks into treatment and essentially you'll end up having to involuntarily commit them. But what I would recommend to families is to have a non-judgmental approach. Before it gets to the severity where they need to go to the hospital, try to get them to go see their doctor. Like, for example, they might be saying, they might be complaining about anxiety or sleep. They're not going to say, they might have paranoia, but they might think that's true, so they might be complaining about that. So try to work with them and try to get them to help for what they're seeking, and instead of trying to lock horns with them and working against them.
Yeah. And you always see signs of when someone's acting like abnormal or dysfunctional, and most of the time you see your family and friend acting different than what they normally act, and they're using like a substance or some kind of clutch just to get through the day. I always think that's a good sign to be like, hey, something is off, like something is I think always thinking drug abuse is the first sign of something mentally is not right. That's what I think. But thank you so much for coming here today, and thank you for giving insight on your background and your experience. It was such a pleasure having you today. Okay,
my pleasure. Thank you
very much.